We're a trust of around 4,500 people, made up mainly of nurses and therapists, but we have a few doctors and other clinical professionals. And we look after the population of those counties and cities, around 1.1 million people. A lot of our reporting capability was taking a month to get through, very retrospective and reactionary.
I'd have maybe a dozen reports on different spreadsheets and different formats land in my inbox on a monthly basis, and it was my job to tie that all together. And I think as a leader, when that comes to you and your priority is clinical care, that's really hard to interact with, that's really hard to dedicate the time to get your head around. People are living longer with multiple conditions and are wanting to be cared for at home, and that's really important for us to be able to adapt to that. It is about making the best use of our resources to deliver high quality care, but in a really value for money way.
When it came to selecting MicroStrategy, we looked at 3 vendors and MicroStrategy came out top. I think the flexibility of the stack that MicroStrategy offered, the easy to use elements that down to individual untrained clinician level, and the fact that you didn't need specialist SQL service capability were big factors for us.
Feedback from leaders is they really love having that level of information, they love being independent with it and not having to rely on someone sending them a report.
Where we've got to today is that the data is now much more real time, gets down to clinician and patient level in a way that's easy to manipulate.
It can help us with resource allocation, it can look at where there are blockages in the system, where teams are going through peaks where they're busier than other teams or where teams are quieter, to make sure we've got the balance of staff right, which allows us to deliver an equitable level of patient care across the county and not have pockets where we're quiet and pockets where we're busy.
One of the attractive features for MicroStrategy was that although it has a very rich data analytical basis, you don't need to be a data expert to be able to use it. Our frontline clinicians were able to look at their own data or their patient data and use it easily, whereas before it required a big information stack to come through to them, which was difficult to manipulate.
We're able to maximise that time that clinicians are spending with patients, so we're seeing better patient outcomes and more holistic assessments taking place in the first visit.
We've seen some of our access times come down from what might have been 60 days to 10 days to get to a service, and our time length of duration on people's caseloads reducing from months and sometimes years down to weeks.
We have a lot more leaders asking a lot more questions of the data and paying more attention to how that might then shape services in the future. And that's just debate and dialogue that we didn't have in the past.
But the opportunities are very exciting, and I can see a way forward as for MicroStrategy for the next few years.